of people have been diagnosed with peptic ulcer, and the truth is they don't really know how this peptic ulcer came to be. Some blame certain foods like spicy foods, eating fruits such as orange, pineapple, smoking, drinking, or even stress as the cause of peptic ulcer. But none of that is true. So this video I'll open your eyes to know the real cause of peptic ulcer. Generally, ulcer means wound or sore, and it can occur at any part of the body. The part of the body it occurred gave it the name it's bearing. If it's at the mouth, we call it mouth ulcer. Genital, we call it genital ulcer. And if it's related to digestion, we call it peptic ulcer. We are dealing with peptic ulcer. Peptic ulcer is of two types, and their name depends on the site of digestive tract the wound occurred. If it's at the stomach, we call it gastric ulcer. If it's duodenal, we call it duodenal ulcer. It's good you know the type of peptic ulcer you have. So what really causes peptic ulcer? It can be caused by two main things. The first one is infection from a bacteria called Helicobacter pylori. This bacteria enters the body through person-to-person transmission via saliva exchange. So if you're kissing someone that has peptic ulcer, you're also at risk of peptic ulcer. Or any form of saliva exchange, maybe sharing of personal belongings like toothbrush. Also, eating foods or drinking water contaminated with feces. So what happens when this bacteria enters the body? Inside our stomach is a layer of protective covering. This covering is not meant to wear or tear. Also, inside our stomach is an acid called hydrochloric acid. It helps in digestion. This acid is harmless only if the covering of the stomach is strong and intact. But when this bacteria called Helicobacter pylori enters the stomach, it weakens this covering, subjecting it to damage. So this hydrochloric acid damages the wall of the stomach, causing sore or wound. That's peptic ulcer. Another cause of peptic ulcer is NSAID, non-steroidal anti-inflammatory drugs. That's painkiller drugs like ibuprofen, aspirin, and others. Abusing these drugs weakens the wall of the stomach, subjecting them to damage by hydrochloric acid. To know if you have ulcer, from your signs and symptoms, your doctor will subject you to certain tests to know if this bacteria called Helicobacter pylori is present. Once it's found in your system, then antibiotics alongside with drugs that suppresses the effect of gastric acid is prescribed to heal the ulcer. In our next video, we'll be discussing how to identify the type of peptic ulcer you have, whether gastric or duodenal ulcer, and what triggers their crisis. Please stay in touch. If this is your first time coming across my video, you're welcome. Please follow Smiley Health 247 for more educative health tips. See you in my next video, and please share this video to reach others. Thanks for watching. Bye.